Member for Kelowna Mission.
Women are suffering disproportionately under the collapsing healthcare system under this NDP government. Maternity services are lacking, leading to clinic closures, frequent ward diversions, and severe shortages of OBGYNs and midwives. Gynecological oncologists are lacking, with the fewest of any province in Canada. Cervical cancer screening turnaround times, well, they've increased to 18 weeks, endangering women's lives. And then there's the growing medical imaging wait times, forcing diseases such as breast cancer to go undiagnosed and untreated. Women are being denied basic health care, and their pain and their health matters. When will this Premier finally deliver the healthcare results that women deserve?
Minister of Health.
Well, thank you very much, Honourable Speaker, and thank you to the member for her question. Women's health has been a high priority for our government from the beginning, and the significant difference has been made both for healthcare providers, in the majority of cases, women, and of course for women receiving care. Significant action has been taken across the board and consistently, including, if we're talking about maternity care, the significant investments in midwives and significant investments we need to increase training spaces for doctors and nurses and nurse practitioners and midwives. It is of highest priority to us every single day. The list of actions that have been taken is long, but what is important is that we have to continue to build our public health care system. It's why we have a Health Human Resources Plan with more than 70 actions for more nurse practitioners and more nurses and more doctors and more healthcare workers, and why I think this government has made a real change in the care provided to women no matter where they are in the healthcare system by treating all healthcare workers, the majority of whom are women, with respect.
Member for Kelowna Mission Supplemental.
The minister's rhetoric, it just doesn't reflect the reality that women are experiencing today. Here's an example of a woman that's facing an issue in our healthcare system right now. In this email, Crystal is pleading for her daughter who is ill. Crystal's daughter's been in and out of the ICU with overworked nurses unable to provide care or answer questions, leaving Crystal, her daughter, and her family in the dark and suffering. Crystal's experience with her daughter at KGH has been grueling and heartbreaking, with packed hallways and a lack of privacy that make it impossible for them or any of the other patients to rest, get information, have some privacy, or just communicate. Crystal's plea is very simple, and I'm going to quote it. Imagine it was your sister admitted to a bed in the hallway, end quote. Across BC, countless women continue to be denied access to basic health care. How much longer is this Premier going to continue to neglect the health of women like Crystal and her daughter?
Minister of Health.
Thank you very much, Honourable Chair. I think as a public healthcare system, over the last number of years, our healthcare workers, our healthcare professionals have demonstrated extraordinary skill and extraordinary compassion under the most challenging of circumstances. 2 public health emergencies presented concurrently and significant challenges people face. Over the last couple of years, for example, the number of people waiting, women and men, on surgical wait lists has been reduced in a time of extraordinary challenges in our healthcare system. It is true at present, there are approximately 10,000 people in acute care hospitals, admitted to acute care hospitals in BC. And this is an exceptional challenge. And our staff under the most difficult of circumstances, have been up to that challenge. They have worked exceptionally hard providing care for everybody, every person in our healthcare system. They deserve our respect, and they have it. They deserve our support, and they have it. They deserve our investment and action, and they've seen it. And we are going to continue to act to support women and all people who need care in our public healthcare system.